Should I wait one more minute just to give people till noon? Okay. Okay, well, it's officially noon. So good afternoon. I always want to say good morning. Good morning, and welcome to your July 22nd Ames Noon Rotary Club meeting. And as always, we will begin with the Pledge of Allegiance. So feel free to stand if you're able. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now please be seated. We can take a moment of silence while we're seated to recognize any members of the Rotary family that needs our extra thoughts today. As you can see on the screen, we have the information. Karen has provided it on the screen here for Frankie Olison and Dr. Walsh services. Looks like both. Oh, no. Dr. Walsh is this week, and then Frankie's is in August. Anyone else that could use thoughts? Anyone know of anyone? Okay. Pausing for a quick moment of reflection for anyone out there that you think might need it. All right, so hope you all had a wonderful weekend. I don't think we have any other special announcements. I didn't think so. So good. Hope you all had a great weekend. Last week we had a great in-person meeting with the filling station, delicious barbecue, great program. So if you haven't been to an in-person meeting in a while, please join us at the Plex next week. And then is Deb on? Okay. I don't think she made it. So I will introduce our three wonderful speakers from MICA today. So let me grab your bios because I want to make sure I say all the right things. Okay, so we have Megan, Carrie, and Clarissa, right? Yeah, hi, good to see you guys. Thanks for being here. Megan holds a degree from the University of Northern Iowa in health promotion. She started at MICA in 2010 and has worked with multiple health programs over the years. She currently serves as the Health Services Director, overseeing 12 programs. Megan also co-leads the Trauma-Informed Resiliency Team and the Health and Wellness Team at MICA. Carrie Sauter, CCAP, has been a part of Community Action for 30 years. She's currently the Chief Program Officer at Mid-Iowa Community Action, where she leads the team of program directors and is the Head Start and Early Head Start Director. She spent her whole career partnering with and advocating for young children and their families. She's committed to supporting justice, equity, diversity, and inclusion in our work. She embraces the attitude of learning and is a lifelong adventurer. What she has learned from early childhood and community action is that interactions and relationships are the key, and time devoted to building connection skills in yourself and others is time well spent. Couldn't agree more. And Clarissa Thompson has served as MICA's executive director since August 2019. Clarissa has a wealth of experience in both direct service provisions and leading major federal, state, and local initiatives designed to improve outcomes for children and families. She's led MICA's involvement in the White House Rural Council Impact Initiative, coordinated extensive disaster recovery efforts for Marshalltown families after the 2018 tornado, and co-created MICA's premier summer learning program, Bobcat University. Her vision of MICA's work is strengths-based, seamlessly connected service provision in which there is truly no wrong door for families. Recently, she has been focused on building agency capacity, creating a data-driven culture, and integrating services across the spectrum to provide a coordinated approach grounded in the whole family framework. So welcome, Megan, Carrie, and Clarissa. Thank you so much for being here.
We're happy to be here, and thanks for the invitation. And we really appreciate the support of the community of Ames and Story County. It has gone unnoticed in our world at MICA. I believe we have some screens. There they are. So I'm going to start the presentation. I'm going to pass over to Carrie, and then Megan will finish off talking more specifically about child and maternal health, which was the ask for us today. So we're Mid-Iowa Community Action. We were founded in 1965, and you can advance to the next slide, please, by President Lyndon Johnson, who declared a war on poverty. In the country, there are 1,000 community action agencies, but we're not called community action. So even in Iowa, we all have different names. Our partners in Polk County are the Impact Community Action Agencies, and to the east is New Opportunities. But we're all blended together to provide services and end poverty in our communities. And what really makes us community action is a little bit of funding. It's not a lot, but a little bit of funding that's from the federal government to the state government called Community Services Block Grant. And the other thing that makes us community action is that our nonprofit board of directors is governed by 1/3 of our members are from our low-income community, 1/3 of our members are from the private sector, and 1/3 of our board members are public officials. So any community action agency in the country and the 16 that are in Iowa, that is the board's governance structure. Next slide, please. Poverty is our work, and our communities have poverty. Every community in the country, and especially here in Iowa, we see poverty. By age 35, nearly 1/3 of the US population will spend a year below the poverty line. For a one-person household, that's about $14,580. For a family of 4, that poverty measure is $31,200. But by age 65, more than half of the population will be affected by poverty, and by age 85, 2/3 of all Americans. Next slide, please. MICA's Story, like I said, we are a private nonprofit organization, and our primary focus is serving children and families in the heart of central Iowa. So we're almost ready to celebrate our 60th anniversary in this life-changing work. Next slide, please. As the Community Action Agency, we're established in 5 counties here in central Iowa, Story being one of them, Hardin, Marshall, Tama, and Poweshiek. But some of our programs, depending on the contractor that we're working for or the contract we have, we expand into other communities as well. Next slide, please. Last year, our board of directors approved and updated to our mission, which we look out every 5 years. And our mission of today is MICA helps families experiencing poverty to meet their needs, build on their strengths, and achieve their goals. And our vision is a central Iowa community that is resilient, where all people thrive. And next slide. We also are driven by our core values, which we call MICA Cares, standing for compassion, advocacy, resiliency, equity, and service. So that is a little bit about the overview of MICA, and I would like to pass to Carrie to talk the next couple slides.
Okay. Hello, everyone. I'll just tell you a little bit more about MICA and the services that we provide. So the first number we have here, almost 22,000 people. That's how many people we served in fiscal year 2023. And to give you a context, filling Wells Fargo Arena with an extra 5,000 people that couldn't have a seat. So that's the amount of people in our five county area that we served. And a little bit more about our health programs. In the maternal health program, since October 1st, 2023, we've served 129 pregnant people and their families. And then in our child health services, since October, we've served almost 1,000 children, 978. And then we do have a overarching goal and target to integrate our services, to interconnect them, so there is no wrong door a family goes in. So if they encounter our health services first, we're going to connect them to other services that they are eligible for and that they would like to receive in our other service areas. So these are general service area buckets. They're health services. You're going to hear a lot about the health services. That's what Megan's going to go over with you. But it does help families in our area to access health, mental health, and dental care resources. And it directly provides nutrition support and guidance, including breastfeeding support. And also our health services staff engage in health advocacy, education, and outreach activities. We also provide early childhood education services. We provide comprehensive early childhood education opportunities that prepare children to succeed in school, along with strengthening parental supports and skills. We do that through home visiting or through classroom services, all of which includes family services. Then we have family development, which includes crisis assistance for water, food, heat, and disaster recovery. We work with families one-on-one to help them set and reach their goals. And we connect families to other resources in the community that are going to meet their needs. And then our housing department makes homes safer. They fix issues like carbon monoxide and gas leaks and weatherize homes so they're more efficient, lowering energy costs and making housing more affordable for families. And I'm going to transition to Megan so she can deep dive into our health services.
Everyone. Yeah, I'm going to talk about our health services, specifically Title V, maternal and child health services. So Title V was enacted in 1935, our oldest federal state partnership. Several states and jurisdictions received this funding. We're federally funded, and we do receive some reimbursement for certain services from Medicaid. You can kind of see some stats there, serving over 60 million individuals through Title V. So specifically, our maternal and child health programs are really here to reduce the barriers, kind of fill those gaps that families are seeing. We provide a lot of education and anticipatory guidance, just kind of helping families understand those best practices for health and well-being. Some of our goals are listed up here: reducing infant mortality rates, reducing smoking during pregnancy, increasing the number of children who are breastfed, increasing safe sleep practices, increasing women who receive oral health services during pregnancy, which is really important, promoting and increasing immunizations, helping families reduce those barriers, and accessing preventative, well child visits, and increasing health assessments. All of these things, providing that whole child, whole family health approach for better outcomes. So how do we do this? We do this in a lot of different ways. We have direct services. So we're very much integrated in our health department. Our child health and maternal health services are integrated with WIC. So when families come in for their WIC appointment, they receive either child health or maternal health appointments, same day, same time, and get free services at the same time as WIC. So we do a lot of routine screenings. For maternal health specifically, we do depression screenings, substance abuse, domestic violence screenings. For children and child health, we will do ASQ or developmental screening, lead screening, lead testing. We provide a lot of care coordination. So a lot of times things will come up in these appointments and they have a lot of barriers to services. And so we provide a lot of follow-up services over the phone, making sure, they got that referral that we gave them in person, maybe asking, if they needed help making an appointment, just making sure they get connected to the things they need. We do presumptive Medicaid eligibility. So this is providing same-day Medicaid determinations so they can get, to the doctor or to the dentist, and a lot of referrals to community resources. That's a really good chunk of what we do, is just providing those community resources and getting people connected. With child health specifically, we do immunization promotion and education. We do not provide the immunizations themselves, but we'll connect them to a provider or a public health service that does those. Oral health services, so we do oral health screenings, fluoride varnish, nutrition education, a lot of referrals for dental care. That's one of the biggest gaps, is getting Medicaid kids on Medicaid connected to a dental provider. We do have some vouchers for kids without insurance, so we can get them into the dentist and provide payment. If they don't have insurance, we can provide payment for that dental service. We do developmental screenings. We work very closely with local AEAs and early access. Lead testing. We link families to medical and dental homes, and a lot of education on the importance of, why it's important to have a medical home, someone who knows your health history and is able to provide good medical care. Our child care nurse consultant does a lot of training and technical assistance for local child care providers. So she's working with those daycares and making sure they're up to speed on all the health and safety guidelines, and helping them implement those best practices in their child care. We also have the iSmile program and iSmile at School, which is all related to good oral health. iSmile at School provides free sealants for schools that have 40% or higher free and reduced lunch rates. This is a list of services we do with maternal health. Maternal health is a great program. It helps people through their pregnancy. We know those doctor's appointments are quick, and sometimes people don't, have the time or aren't thinking of all their questions during that appointment. So maternal health is a program where any pregnant person can see our maternal health nurse once per trimester and at least once postpartum to get extra education and support. They do different screenings to kind of assess where that person's at, and then we'll work on goals towards healthier behaviors. Postpartum, our maternal health nurse does listening visits, which is a support for more of the baby blues, not necessarily postpartum depression. If there's significant depression, they're referred to a licensed mental health counselor, but just kind of helping support those new moms in their first few days and weeks with baby, and providing that kind of listening ear and support system, working out the first new days, which can be tiring, overwhelming, all that good stuff. We also can do a postpartum home visit, which we'll do an assessment of mom and baby, just a health assessment and a mental health assessment of mom as well. Our nurse does dental screenings and does a lot of care coordination, linking pregnant women to dental services. One of the really nice things about Story County and our health services in Story County is that we're very much connected with the local medical community. So Dr. Passion is our medical director. Dr. Anderson is our first 5 peer-to-peer consultant and helps us work with other providers throughout our service area. Dr. Postler at Primary Health Care Dental in Ames has been fantastic to work with and getting kids in that we see that have significant decay. She'll work them into her schedule and make sure that they get the treatment they need. And we hold a monthly baby basics class at Mary Greeley, and we partner with them to educate new parents. Some of the other connections we have in Story County is with our local CPPC group. For, oh gosh, probably the last 5 or 6 years, we've done their Safe Seat program. So they provide the funding and we purchase car seats for families in need. So then we distribute those. And then we've also been able to get extra dollars the last 2 years to do a safe sleep program. So through CPPC funding, we provide pack and place to families who otherwise do not have a safe sleep environment for their child. I think there's something in the chat, so I'm going to check that to make sure I didn't miss any questions before I keep talking. So what effects did you see after Governor did not accept federal funds related to food? So this summer was interesting because we do connect a lot of families and tell them about the benefits available to them. And the summer food benefits were different this year. So we actually had, well, Story County specifically had a lot of meal sites and different things available through like the Ames Public Library and other entities. So we were able to share that and get the word out to families. I think United Way initially sent that information. And so we were able to share that with families. And I did not hear a lot of families asking for more, but maybe, you know, the food pantry may have. So I don't know if Larissa, if you have any data or information maybe from the food pantry.
Yes, thanks, Megan. I also responded there in the chat. So every 3 years, we conduct a community needs assessment. And so last summer, that was rounding up that data, and food insecurity was the #1 need identified by our families. And we had done this survey for 11 years as a trend set to identify trends. And this is the first time in 11 years that we've seen food insecurity be the #1 need by our families. The other question about funding, so we're talking more specifically about the food pantry that we operate at our office in Story County, is highly supported by the asset funding, which comes from the city of Ames, the county of Story, and United Way, and I believe ISU as well. But it's mostly supported by the community. We have wonderful partnerships and private donors that are providing us funding to purchase food from the Iowa Food Bank, which is low cost for us to do. The city of Ames also, through some funding through the COVID funding, was able to provide us with a really nice new van. And we've started a mobile food pantry that we're able to make deliveries. And we've seen an increase, obviously, for folks, transportation being a barrier, or for those in rural Story County who are not able to travel to Ames. So we've taken up the practice of mobile food distribution, whether in a community, at place, or individually to homes. As far as the agency as a whole, the majority of our budget is federal funding. Sometimes that federal funding flows through the state and then to us through contracts. We also have state and local funding and that we receive, as well as private donations. So I hope that answered your question. I'd be happy to answer or share more information.
I was just going to add, Clarissa, that I talked to one of the folks that works at the food pantry in Story County, and they have seen an uptick in in folks that are visiting the food pantry, and she just, you know, connected it with the change in the food assistance from the state level decisions. So it's been very, very busy there. A lot of need.
I think one of the other things we've done, since we know food is one of the top needs, is really promoting WIC and just pushing that information out wherever we can. A lot of families qualify and don't know they qualify, or qualify and think, oh, someone maybe needs it more than I do, so I don't want to take that benefit. So we're trying to kind of take those ways of thinking away. No one's going to not get a benefit because someone needs it more. That we, you know, we're federally funded. WIC has funding to support everyone who needs it in our service area. And the WIC numbers have grown. Old data a couple months ago was over 6% since January. So they continue to rise, and we see more and more families each month. So we're trying to kind of just share that information to let families know that that is available to them.
I also wanted to share that while we talked about poverty line and being in poverty, our services also are supporting families that are not able to make ends meet. So that may be above the poverty line. So every one of our programs has a different eligibility criteria. So that's also a thing that families have to move through as well. So maybe the energy assistance program, that's a 185% of poverty versus the poverty line being at 100%. So it's really gauging eligibility for programs is something our staff are also well versed in to help families access the resources that they're eligible for. In the food pantry, we have what we also call, of course, I can't think of the top need, that it's come and go. So we don't even ask income. You come in, get what you need. The other part with the Iowa Food Bank, we have to manage eligibility, but there's opportunities to make those things work regardless of income in some of our work.
So I think there was a question about unfilled needs due to lack of funding, and I can share just a couple, and Clarissa and Carrie jump in, but probably one of the top needs we see is dental care. This is an ongoing concern. It's statewide, but the number of dentists that accept Medicaid are very, very few and far between. And partially that's because Medicaid rates are so low. So it's kind of hard sometimes for a dentist to run a business and not get reimbursed. There's a lot of reimbursement issues with Medicaid as well, but kids are going without dental care, and that's a real issue because it's affecting their overall health. So we see kids with decay that's so severe that they can't eat, they're not going to school, they can't sleep, they have behavior issues, all of these things. We can't get them into a dentist because they won't accept Medicaid. So our I Smile coordinator, that's her job, is building those partnerships and getting dentists to take our referrals, one, take our vouchers, two, for kids that don't have insurance. And Story County is pretty great. We have primary healthcare dental. Dr. Postler's been great. Amy Rockow Nelson has been great about taking some pro bono cases. But it's still, every time we see a kid, it's making all the phone calls, jumping through hoops, begging providers to take this kid who, hasn't eaten for 3 days because their mouth hurts. So that's one of our top needs. The other thing we see is maternal mortality continues to rise. So high blood pressure in pregnancy and postpartum is a real concern, and it continues to be something that's affecting more and more women. So we're trying to do a lot of education and support to these pregnant people, but less maternal health centers or birthing centers available in some of the rural areas. That causes a problem. And starting January 1st, there's new guidelines for postpartum Medicaid coverage. So on one hand, it's really great because they'll extend postpartum Medicaid coverage to 12 months rather than 60 days is what it is now. But on the other hand, they're lowering that federal poverty level, the qualification. So right now it's, if someone is 375% of the federal poverty level, they qualify for postpartum Medicaid coverage. As of January 1st, it'll be 215%. So there's going to be this gap of people that are not covered. And that's probably going to cause a lot of people to go without the medical care that they need. So that's the other thing that we have on our radar right now. I'm looking in the chat. Last week's speaker brought up a topic about 12-year-olds and younger being more depressed, in part due to phones. We do see an increase in referral needs for kids with mental health concerns, behavior issues. That has definitely jumped up since COVID for a lot of different reasons. We see a lot in First Five. We do a lot of counseling referrals. We do a lot of behavior intervention referrals, whereas we used to do more speech therapy, occupational therapy, things like that. So we are seeing more of that. And I think, Carrie, they've seen some of the same concerns in Head Start, early Head Start as well.
Yes, agreed.
Okay, a lot of really good questions. Thank you, Carrie, Megan, and Clarissa. I can't appreciate you guys telling us more about Mid-Iowa Community Action. Always good for our group to hear more or something new. I say this often, but aren't we so lucky to have your group in our county and surrounding counties? So thank you, thank you. Also, I didn't notice at the beginning of our meeting, but we have Steve Schraderbacher, our new assistant governor. I won't put you on the spot, Steve, unless you have something you want to say, but just give a wave and hopefully we can have Steve join us at a meeting sometime soon. He is part of Rotary Club of Ankeny's club, so he's close by, which is nice. And is there anything else, Karen? Any members, anyone need anything? Have anything to say? Okay. So as I said earlier, next week we'll be back at the Plex for an in-person meeting for our 5th Monday of the month, which is great. So we'll have 2 back-to-back next week. And then the following week will both be in person. And I think I'll just leave you with my kindness quote of the week, which is be a little kinder than you have to. So with that, please stand and join me in the 4-way test. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendship? Will it be beneficial to all concerned? Oh, that was it. I'm so sorry, guys. Flubbed that one up. So you guys have a little bit of time left for your day. Go outside. It's gorgeous. And we'll see y'all next week. Thanks, everybody. Have a great Monday.